study revealing a startling number of people living with diabetes without even knowing it. According to data published this week, of all 830 million people ages 15 and older who have diabetes globally, almost half don't know they have it. The majority of cases are type 2 diabetes. Around 1 in 9 adults live with diabetes worldwide. In the U.S., 11.6% of the population has it. The American Diabetes Association suggests annual routine screenings for adults 35 and older. So joining us now, Dr. Richard Siegel, the co-director of the Diabetes and Lipid Center at Tufts Medical Center. Thank you so much for being with us today.
Thank you. Thank you for having me.
Yeah, absolutely. You know, it really is surprising to hear that. I know you just looked at the study. Were you surprised at those results?
You know, not that surprised, because there has been an increase in both type 2 diabetes and overweight and obesity over the last few decades, you know, per se. And because early type 2 diabetes may not have any symptoms at all, it's not that surprising that most people are unaware of it. It depends on whether they've seen their doctor and have had screening done, and whether they may have symptoms. And the majority of people do not have symptoms. We know from studies going back a couple decades that about a third of people with diabetes were unaware of it. So these numbers have gone up.
You talked about symptoms, and some people, you know, don't show a lot of those symptoms, but the ones who do, are the symptoms different in younger people than symptoms in older people?
Not necessarily. I think if blood sugars are just slightly elevated, there may be no symptoms whatsoever. When blood sugars get very, very high, what we call decompensated diabetes, there may be an increase in urination, there may be an increase in thirst, there may be fatigue, there may be weight loss that people are not expecting. But for mildly elevated sugars, most people are not going to be aware.
So for people who want to learn more about their blood sugar levels, where should they start, especially if you're younger, because you don't often go and just get your blood sugar checked?
Now, certainly I know there's been a shortage of primary care, and the majority of screening is done in primary care. Very often in communities there may be screening. Often during National Diabetes Month in November, there are screenings in different communities. And the way diabetes is screened is generally either with a fasting blood sugar, so that's an overnight blood sugar without having eaten for usually 8 to 12 hours, or a blood test called a hemoglobin A1C, which is an average of blood sugars over the last 2 to 3 months, with blood sugar attached to red cells. So those are the primary ways that this could be screened. And if someone is found to have type 2 diabetes on screening, it's suggested to speak to a healthcare provider, and initially really just working on lifestyle. In our clinic here, we see people with at risk for diabetes, with prediabetes and diabetes, and are focusing significantly on healthy eating and activity, as working on that has been shown to reduce the progression of prediabetes to diabetes. And for those with early diabetes, it may help to get their blood sugar back towards normal.
Yeah. Well, Dr. Siegel, we truly appreciate your time and your insight on this. Thank you.
Thanks so much.